A very good morning to panel of evaluators. So my name is SUVIK ASSAW from University of Malaysia Terengganu. Today I'm going to present about my finding entitled Anti-Inflammatory Mechanism of Lipid Mediators and N-Palmitoylethanolamide in Ameliorating Toll-like receptor for Carrageenan-induced acute inflammatory pain. Before we go further, I would like to give a basic introduction about what actually inflammatory pain. So imagine this is our normal skin. Whenever our normal skin having injury, such as from bacteria or allergen or infection, so the damaged cell will immediately release many mediators such as prostaglandin and also chemokines that responsible for the blood to dilate and cause the infiltration of immune cells such as neutrophil, macrophages, and also mast cells. All of these cells will release more pro-inflammatory mediators to attract more other immune cells in order to fight the infections. And at the same time, these pro-inflammatory mediators such as cytokine, chemokines will activate the nerve ending and cause the pain. So this is the basic principle of the inflammatory pain. And now I'm going to talk about the lipid mediators that I use in this research, which called N-Palmitoylethanolamide, also known as a PA. So PA actually an endogenous fatty amide and naturally occurring fatty acid ethanolamide that related to endocannabinoid. So actually the PA first isolated in 1940s from egg yolk to prevent reoccurrences of rheumatoid fever and also microbial infections. So PA are known for the ligand for what we call it PPA alpha, which is the peroxisome proliferative activated receptor alpha, and activation of this receptor can lead the compound to have anti-inflammatory and also anti-nociceptive activities. So regarding to this research, so actually it started from our previous study in our laboratory, where we have conducted a pain study in animal using a spectral-lead rats. So we have injected the paw of the animal using toll-like receptor 4 ligand, which is Carrageenan, a SUVIK extract. So when we pre-treated the animal 30 minutes before the Carrageenan, it shows that the PEA able to inhibit pain at certain time of point, which is at 2 hours in this graph, as you can see here. And we just wondering what actually happening at this 2 hours time, why the PEA has the ability to inhibit pain only at 2 hours and then it lost its effect at 3 hours. So we repeated again the experiment just focusing at the 2 hours time point. So our hypothesis why PA actually having this kind of effect, it probably caused by the activation and recruitment of specific immune cell, or the PA actually control the production of specific anti-inflammatory cytokine or chemokine that is responsible for the cell attraction. And also the PA might also decrease the suppression or suppress the specific pro-inflammatory signaling pathway, which is in this study NF-kappa beta. Okay, so when we repeated again the experiment, so this is the in vivo methodology, where we again injected the PA 30 minutes before the Carrageenan, and then we assess the pain and also the swelling by using weight bearing machine and also plastimometry at different time point, and then at the 2 hours time point at the end of the experiment we collect the hind paw tissue and use in immunohistochemistry to study the specific immune cells such as classical activated macrophages and also neutrophil in the skin tissue. And the tissue also subjected to a gene expansion study where we studied 96 genes that related to inflammatory pain. Okay, so this is just a basic summarization of the experiment. And this is the machine that we use to measure the weight bearing of the animal. Okay, whenever the animal having pain at one hind paw, it will lift the pain into the other side. So the difference between the pain, the weight, uh, uh, is considered as pain. And we also have conducted the in vitro study using the red peripheral blood mononuclear cell and activated it into macrophages in order to study the effect of PEA on the activation of macrophages, because our hypothesis that macrophages is the main cells that cause the pain, and also the PA might have some effect on these particular cells. And also we measured the chemokine production that released from the macrophages. Okay, this is the list of the 96 genes that we have studied from different factors that control the inflammatory pain, such as pro-inflammatory cytokine, chemokines, adhesion molecule, neutrophil phenotype, and also we're looking at the what we call it factors that control the activation of nuclear factor kappa B pathway. And again, the results show when we give the carrageenan, the animal experience quite intense pain. You can see here that the red line, it increased very drastically. And when we pre-injected the animal with the PEA, it shows that the PA again inhibit the pain at 2 hours. However, even though that PA inhibited the pain, but it did not inhibit the swelling. So it's very interesting. So we're just thinking that it must related to specific immune cell that infiltrated into the hind paw. So when we look into the neutrophil, interestingly that the PA did not reduce the infiltration of neutrophil into the hind paw. So that's why I think the PA are not able to reduce the edema, because all of the cell keep infiltrating into the hind paw. And when we look into the macrophages, interestingly that PA actually significantly inhibited the infiltration of the macrophage into the hind paw at 2 hours. And then we reconfirm it again, the role of macrophages in releasing the pro-inflammatory mediators. So we conducted the in vitro study. And then in the in vitro study, almost similar result have been shown that PA actually has the ability to inhibits the differentiation of mononuclear cell into activated macrophage. So if the PA able to inhibit the differentiation, so it can inhibit the production of inflammatory mediators such as cytokine and also chemokines. So when we look into the specific cytokines such as interleukin-1 beta that play a role in pain generation, and we show that the PA able to inhibit the interleukin-1 beta in the macrophages, either from the in vitro and also in vivo study. And interestingly, that PA actually selectively inhibit certain type of chemokines that related to the macrophage infiltration, such as the CCL4, but it did not inhibit other chemokines such as CL10 that responsible for neutrophil infiltration. So that is why I think in the hind paw it showed that the PA able to inhibit macrophages but not the neutrophils. So then we also thinking that why the PA actually have a selective effect. So it probably might have some effect on the what we call it activation of different isomers in the nuclear factor kappa B pathway, because we know that the dimerization or combination of different isomers such as rail A, P65, or rail B in the NFKB pathway might cause the production of different cytokine and chemokines. So when we conducted another study looking at the NFKB rail isomer, again it showed that actually PEA have different effect on different isomers. As you can see here, that PA it inhibited the rail A P65, but it did not inhibit the rail what we call NFKB to P49 or 52. So the combination of the isomer might lead to the selective effect of the PA on the chemokine and also cell infiltration. So as a conclusion, pre-treatment with PA inhibited Carrageenan-induced inflammatory pain response, but not hind paw swelling. And PA significantly reduced recruitment of monocytic cell, but not neutrophil, into the hind paw. And PA inhibited LPS-induced monocyte infiltration into macrophages. And PA also selectively reduce the expression of carrageenan and LPS-induced inflammatory cytokine and chemokines. And PA also inhibit the expression of all the NFKB isomers. And this suggests that the effect of PA and FKB are not responsible for the different effect of chemokine productions. And this is acknowledgement. Thank you.